Good evening, and welcome to our public debate. Tonight's topic is resolved. The United States should mandate vaccination. Before we jump into the debate, I'd like to give you a little background. My name is Adrienne Brovero, and I'm the Director of Debate here at the University of Mary Washington. We represent the debate program at the University of Mary Washington. We compete in intercollegiate policy debate tournaments, and we produce public debates on timely topics. Until now, most of our public debates have taken place on our campus in Fredericksburg, Virginia. Tonight's public debate is our very first online public debate. Our participants are distancing across Virginia, Maryland, and the DC area. We began preparing for this debate as part of our public debate class in late January. We had planned to debate in March, but obviously our plans were altered. We've regrouped though, and we're excited to welcome you to our first foray into online debating. And we're proud to be one of UMW's first efforts to resume public events in light of COVID-19. As I noted, our topic is resolved. The United States should mandate vaccination. The affirmative team, first year Ainsley Rucker and sophomore Patrick Healy, will advocate for the resolution. The negative team, senior John Hebler and first year Andrew Hudgens, will oppose the resolution. There will be 4 constructive speeches, each followed by a cross-examination, and then we're going to pause the speeches to allow comments and questions from you, the audience. We'll be using the Q&A function, which you should be able to see at the bottom of your screen. If it's not there right now, if you hover over it with your mouse or with your finger, it should appear, and we'll figure that out when the time comes. After that open discussion period, we'll conclude with some closing speeches from each side. But first, we're going to begin with hopefully, we're new here, with a poll to see where the audience stands on this question. Hopefully you're seeing a poll on your screen. It does not seem anyone has voted, so maybe the poll is not showing up. I'm going to take another stab at trying restarting it. Okay, welcome to our new online world where things work when you practice them, but don't always work when you try them. Hang on one moment and we'll give it another shot. My apologies. We're off to an inauspicious start here. Let's try this again in a different way. It's the third time the charm. Or not. Okay, well, the poll wanted you to answer what your opinion was of mandatory vaccination. So I'm going to ask you to think about that for a moment. The options were strongly in opposition, moderately in opposition, undecided, moderately in favor of mandatory vaccination, or strongly in favor of mandatory vaccination. So think about what your answer would be. Sadly, we will not be able to do the poll on it for reasons. And meanwhile, we're going to ask at the end to assess your opinion again. So if you can think about what your opinion is now, we'd appreciate that. And we will revisit the question at a later point. So much for our poll. It's on my screen. I don't know why it's not on anybody else's screen. But anyway, so much for the poll. I'm assuming we probably have some mixed opinions out there. I guess we'll find out hopefully during the question and answer period. So without further ado, and hopefully without any further technical difficulties, I'd like to welcome Ainsley to deliver the first speech for the affirmative team.
Awesome, thank you, Adrienne. So hello, my name is Ainsley. I'm a first year at UMW and a philosophy pre-law major with a minor in practical ethics. I'd like to thank all of you for taking the time to come out here today, and I hope your impromptu break is going as well as it can. I will be giving the first and last speeches from the affirmative side of this debate. In 1998, Andrew Wakefield and his colleagues published falsified studies claiming that the MMR vaccination was linked to autism, starting what would end up being the most prolific anti-science movement in modern history. According to the New York Times, rates of unvaccinated children continue to rise, and eradicated diseases like polio and measles are coming back. The question is asked, how do we stop this? Despite science proving time and time again that vaccinations are safe, people still choose not to get themselves or their children vaccinated, potentially putting them at risk of countless deadly diseases, attempting to prevent something that doesn't even exist. According to the Children's Hospital of Philadelphia, every year vaccines save 2 to 3 million lives worldwide, and yet 1.5 million people will still die from preventable diseases, many of them children. If these children were vaccinated, their lives could have been saved. When these children are prevented from having life-saving vaccinations, their parents are signing their death certificate. In public schools, a number of vaccines are already required. Virginia specifically has 8. But some people can qualify for religious or other exemptions. Currently, only 5 states have no exemptions, according to the National Conference of State Legislators. We advocate for the removal of non-medical exemptions and require vaccinations for all Americans so we can stop deaths from preventable diseases. A number of European countries already mandate vaccination, and the legal precedent has been set in the United States. Enforcement of mandatory vaccination is simple. Students can't enroll in schools, public or private, without the vaccinations required at that age. Vaccinations are already provided at schools for free, so no excess cost is imposed on families. The next hurdle is ensuring that all adults get vaccinated. For these individuals, employers should mandate their workers go to get vaccinated, which is already done in some professions, like the medical field. A study in the Journal of Pediatric Pharmacology and Therapeutics found that the most prevalent factor in people choosing not to get vaccinated are health concerns derived from misinformation. Dozens of conspiracies exist regarding vaccination, that they cause autism, other disease, are a form of population control, or a way for the government to implant a chip into you to control your mind. By requiring vaccinations, those who previously didn't go to a doctor have a form of discussion that is opened up where they can resolve these fears. Conspiracies are a symptom of an underlying problem in our country, and this problem is the lack of trust for government agencies. Many of us read this year's common read, Educated. The story is a real glimpse into the way many Americans live. There's an urgent need for people to step in and prevent conspiracies like those in this book from running wild. It is also important that we don't demonize parents who are only doing what they think is right. Conspiracy theories are especially dangerous today, in a world where politics and daily life is so polarized. New York Times reporter Jan Hoffman, a behavioral health reporter, said that conspiracies are fueled and reinforced by hundreds of websites that promote anti-vaccination rhetoric and go largely unchecked. Any effort to curb those conspiracies has the possibility to prevent people from becoming involved. We need to take action to prevent dangerous conspiracies from taking root in vulnerable communities and further increase the public health and safety across the country. In an effort to increase public health, a 2014 court case decided it was constitutional to mandate employees to get vaccinated to remain at the company. This February, the Fifth Circuit Court upheld a decision that it was legal for a workplace to mandate vaccinations, and that a workplace could let a person go if they refused to get a vaccine. Moreover, a study was done by the Journal of American Academy of Pediatrics proving that mandatory vaccination programs do work. Mandatory vaccination has been effective in maintaining high vaccination coverage in countries such as the United States. Mandatory vaccination was associated with lower measles incidence for countries with mandatory vaccination without non-medical exemptions. Already, immigrants entering the country are required to get certain vaccinations, and it is important we set the same health standard for people already living within the United States. We need to stop death from preventable diseases and stop the spread of anti-vax conspiracies, and the only effective mechanism to do this is through mandatory vaccination. Thank you.
Alrighty, so what would you say is the primary reason people don't get vaccinated in the status quo?
So the primary reason is going to be this prevalence of misinformation regarding the safety of vaccinations, but also some people just have personal reasons that they don't want to get vaccinated, like they hate needles.
Right. And so what exactly are you doing to help combat this misinformation that leads to these conspiracy theories you're citing?
So misinformation being so widely available on the internet, people don't always go and check with their doctor about the thing they saw on Facebook is true. And when you have people who don't even go to the doctor in the first place, there's no way for them to resolve these fears besides just multiplying them on the internet when they see more misinformation. So when these people start going to the doctor, they're going to have that form of discussion opened up.
I'm sorry, so all that we were required to increase vaccination rates is just to get people to go to their doctors? Well, why do we need to mandate vaccination to do that? Why can't we just—
That's not the only reason we're doing that. We're mandating vaccination to prevent preventable disease, to stop death of preventable disease, such as measles.
Well, yes, but at the end of the day, in order to do that, you just need to get people vaccinated, correct? So why do we need to mandate it? If the primary cause is just misinformation, how exactly are you going to increase people's trust in the government, increase their trust in the medical establishment by mandating they go to the medical establishment to get vaccines if they don't trust them already?
So we can't mandate trust, but we can mandate people at least have a forum of communication, a line of communication between themselves and a professional. And with this line of communication, people will have their fears resolved. And in the process, we will be preventing deaths from diseases like measles or like
So
measles,
how many
mumps,
people
rubella,
currently, how many people currently are vaccinated in the United States of America?
Roughly 80%. It
Eight-
varies for each type of vaccination.
And is every one of those 20% who doesn't want to get vaccinations just motivated by misinformation, or are there other reasons, like religious exemptions, for instance, that prevent people from wanting to get vaccinations?
No, yeah, there are also religious exemptions as well as just personal philosophical exemptions.
All right, thank you.
Thank you.
Hi, my name's John. I'm a senior philosophy and political science major. It's bittersweet, but this will be my last debate at UMW. It's been a long time coming, and I've had so many wonderful people help me along the way. UMW Debate is an awesome squad with the best students, coaches, and alumni in the country, and I'm eternally grateful to them. As I was saying to Adrian the other week, I really can't wait to give back to UMW Debate, but also the debate community at large. I know I also have a lot of family and friends watching. To them, I want to say thank you so much for your love and support on this journey. I'd also like to thank all of you as well for joining us in these less than ideal circumstances. Even though the virus has disrupted many things, my graduation included, I think it's important we continue to do events like these. And with that, I'll get to my speech. Because mandatory vaccines hurt our freedom and ability to respond to future health crises while the existence of less restrictive alternatives exists, we stand in firm negation of the resolution. In this introductory speech, we will lay out 2 points in support of our argument. First, we negate the resolution on the basis of harming personal freedoms. In fact, there are several groups who do not want vaccines due to religious, cultural, or personal reasons. For example, Native Americans on tribal lands, the Dutch Reformed Church, and the Church of Christ. While vaccines may be good, we do not believe it is right to force everyone to have them. According to Julie D. Cantor, health law and policy lecturer at UCLA, mandatory vaccination sets the precedent for a police state that can impede upon our bodily integrity. This leads to lower trust in government and decreases the effectiveness of the affirmative. She writes, because most people can choose vaccination, forced vaccination seems evocative of a police state and a sharp departure from the principle that governments may not invade in our bodies. Forced vaccination could inflict trauma that could deter families from obtaining medical care entirely. Will troopers wrest children from their parents? Evidence suggests people respond poorly. Authoritarian tactics may escalate tensions and galvanize opposition. A combative stance can stigmatize insular communities. Thus, allowing for exemptions or providing public information are viable alternatives to preserve freedom of one's body and freedom of choice. These options are available in the status quo as, according to the CDC, states have broad authority to promote health through public guidance and making information available, which they have tended to exercise during public health crises. These options can easily remediate the harms identified by the affirmative and prove less restrictive means exist. The current coronavirus crisis highlights many of the problems we have isolated. Above all, there's a fear about well-being, especially when faced with restrictive quarantines that harm the economy and interfere with day-to-day activities. When trust in the government and healthcare falls, we all suffer. Ever important in today's backdrop of a global pandemic with so much uncertainty, we are indeed at a critical juncture. Our second point is that implementation of their proposal would make the problems they highlight worse. Mandatory vaccines force companies to switch to expensive production that trades off with research and development and overburdens infrastructure. According to Paul A. Offit, UPenn School of Medicine pediatrics professor, vaccines are used at most several times in a lifetime. Drugs are used every day. The market for drugs is greater than vaccines. To determine where they should invest, companies evaluate a product's potential to contribute to their bottom line. Among the 4 large companies still making vaccines, none has revenue from vaccines that exceeds 10% of total revenue. Because people paid for vaccines out of their own pockets, doctors could depend on reimbursements that offset the enormous infrastructure required to purchase, store, administer, and record vaccines. In 2004, the CDC changed its recommendation for the influenza. Administration fees were about 5 to 10% above the cost of the vaccine, compared with a 300% markup for vaccines when the private market consisted of direct out-of-pocket payments. The cost to develop is greater than that to make most drugs because the products given to healthy people are held to higher standards of safety than those given to people who are sick. Trade-offs and industry uncertainty leads to less money for research and development, which harms industry. Additionally, their focus on ratcheting up vaccines at the slightest sign of disease could lead to resistant diseases. As Jeffrey Sachs, Columbia Sustainable Development professor, writes, required medical responses lag behind emerging diseases. In any event, such tools must be continually replenished. This requires cutting-edge biotechnology, immunology, and ultimately bioengineering to create large-scale industrial responses. AIDS called forth tens of billions of dollars for research and development and substantial commitments by pharmaceutical industry to produce drugs at a global scale. In sum, mandatory vaccines invade personal freedom and make our ability to defend against diseases more difficult. The affirmative is only in absolutes. Get your vaccine, or your kid is kicked out of school, or you lose your job. We're not anti-health or trying to promote conspiracy theorists, but we are just as concerned about the general public and health as our opponents. Thank you.
Awesome. So would the negative consider California to be a police state?
No. May I ask what direction of questioning you're going down?
Yes, California mandates vaccination and they're not a police state, as you agree. So what makes the rest of the United States a uniquely slippery slope?
We would say that the slippery slope occurs when we are substantially curtailing religious freedom and also like our freedom of choice for determining like what medicine we take. The slippery slope could easily apply to cases of, for example, abortion or mental health.
Okay, so Trump just within the hour has pulled U.S. funding from the World Health Organization. So how do we ensure politicians let experts take the center stage when spreading information when they are right now with the coronavirus pandemic not letting them do that?
Sure. I would like to emphatically say that we are not defending the status quo. When we say that we believe in spreading information, we say that the status quo is wholly inadequate at helping public health. It is very troubling, like what our president has been doing, and especially others around the country who are spreading such misinformation. As the affirmative even points out, much of this misinformation is what is causing a lack of trust in the medical establishment. We think that this is definitely something that we as a country need to make.
Okay, how do you stop it though?
We would point to, for example, like issuing public guidance, allowing for different types of announcements of like health benefits, putting key people at the forefront of talking about health in our country. We certainly think it's better than kicking a kid out of school or making someone lose their job.
Thank you.
All right. Hi, everyone. I'm Patrick Healy. I'm a sophomore, and I'm a double major in political science and economics. Thank you all for being on here with us. Okay. So, as we've said, mandatory vaccinations are integral to protecting everyone from the spread of preventable diseases. We think that the spread of misinformation is a problem that can put lives and health of many people at risk, but that's why we support mandatory vaccinations for everyone in America. In this speech, we'll respond to the arguments of the negative and continue our case for mandatory vaccination. On the negative's assertions that mandatory vaccination reduces freedom, we ask how much freedom do people have when they're at risk of getting sick or dying because other people don't get vaccinated? How much freedom do we have when we're forced into lockdowns and stay-at-home orders like we are now? We object to the argument presented that says that mandatory vaccinations reduce our ability to respond to future health crises. Evidence shows that vaccinations are amongst the most important measures we have to prevent dangerous diseases from spreading in the first place. In 2015, Liam Drew of Nature wrote that when enough of the population is vaccinated, that we achieve hereditary immunity. Hereditary immunity is when enough people are immune to a disease that's ability to occur and spread is next to zero. This is part of the World Health Organization's long-term plan to eradicate many diseases around the world. Vaccination is the core part of eliminating deadly diseases, including MMR. When people choose not to vaccinate their children or themselves, there can be disastrous consequences. In 2017, the US had the most cases of measles it has seen since 1992. The United States had so many cases, it was on the verge of losing its status as a measles-free nation. The negative's own author, Paul Ofted, a pediatrician at the University of Pennsylvania, said that when immunization rates drop in hereditary immunity phrase, it's always measles that comes back first. In 2017, the World Health Organization said that caution about vaccines was among the 10 biggest threats to global health. This alarm has caused several countries, including France, Australia, and Italy, to act. Several states in the US have doubled down on measures to make it a requirement that children be vaccinated for them to attend school, and even taken away some religious exemptions. Often went on to say that people would educate themselves about vaccines and make the best decision for their children and for themselves, assuming there's not a medical contraindication, they'd get vaccinated every time. Often is making it clear that not everyone is doing what experts and doctors recommend, and they never will, because we don't spread the truth and facts effectively, and there's no way to guarantee that. Often is saying that if there are no external forces fighting the practice of vaccination, then most people would get them and herd immunity might remain intact. Due to the effectiveness of vaccinations since they became widespread in the mid-20th century, the occurrence of outbreaks of preventable diseases has nosedived. This is attached to the idea that diseases as a threat to our health are now overstated and overplayed in society. The negative plays right into that assumption by saying that freedom is infringed and the cost of the vaccine outweighs the benefit. We disagree. Safety and security are attached to the debate of what role our government should play in sacrificing some perception of freedom for the state of mind of the society and nation as a whole. As we stated in our first speech, we're advocating mandatory vaccination. We're not going to resort to police-style tactics to implement it. So in conclusion, the negative says that our plan infringes on freedom and impedes our ability to respond to future crises. We have the ability to prevent outbreaks of certain diseases, and what is the point of having them if we don't use them to their full effectiveness? Second, this debate about freedom centers around a question of, is some freedom necessary or is it worthless if it gives us no inherent benefits as a society? On this question of vaccination, we say the answer is that it's totally worthless. Second, the negative talks about the impediments this plan places on our ability to combat crises in the future. We haven't seen much evidence that we actually take away from our ability to retreat medical crises in the future. In fact, if anything, mandatory vaccinations would make it less likely and less frequent that we find ourselves in a crisis that requires rapid response and action to combat it in the first place. So the final thing we'd say is, they talk about freedom and prevention. Who truly gives you that? We believe we save money, protect lives, and do more to prevent outbreaks by mandating vaccinations. We believe there is utility to doing this because the benefits of being proactive far outweigh the costs of having to be reactive.
All right. So first off, so we mentioned in our speech that continually diseases adapt and change, and we need to come up with new medical responses to that. When you say mandatory vaccines, would this include vaccines for new diseases, but also new strains of current diseases?
Yeah, of course. That's why of course, because that's what booster shots are for. And for the new vaccinations, yeah, we require that as long as it's proven that they're safe and that they will treat the disease and not contribute to more problems.
Okay. And so, for example, the coronavirus vaccine, when it does come out, would be one of the mandatory ones?
Yes, absolutely. If it's proven to be effective and safe, yes.
Okay. So I guess my question then is, we give a statistic where in 2004, the CDC changed its recommendation for influenza, and administration fees that doctors were giving out were considerably higher, and they had to pass off those fees to their people. Who exactly is going to be paying for mandatory vaccines?
Well, administrative fees are something that has to do with dealing with the insurance companies. It doesn't have to. That's not caused by the vaccines themselves. That's caused by the way the insurance system is set up. And if we wanted to reform the insurance system and cut administrative costs, we could do that. But that's another discussion.
Okay. My next question is, how does the affirmative reach, I guess, sort of groups that aren't so interested in vaccines right now, especially ones that you say you would increase discussion with?
I'm sorry, can you say that again?
Yeah, how would you reach groups that have sort of have objections to vaccines now? I guess sort of how do you prevent them from feeling like isolated from this new mandatory vaccination system?
I mean, I mean, they'd have to comply because it's in the best interest of the society. Um, so um, it's not about making people feel isolated. It's about protecting people from disease and making sure that everyone's safe. And this is a measure to make sure everyone is safe.
Okay, thank you.
All right, hello. I'm Andrew. I am a freshman. I will be delivering the next speech. Thank you all for coming out tonight, and I hope you're staying safe. We agree with many of the affirmative's positions on the use of vaccines. We agree that vaccinations are life-saving medicines that are essential for public health. We agree that vaccination use should be as widespread and readily adopted as possible. However, so long as less restrictive measures that respect freedom of choice while helping public health are available, and so long as the anti-vax movement is motivated by a distrust of government and the medical establishment, mandating vaccinations is not an effective or appropriate measure for improving public health. Our argument for personal rights far outweighs the affirmative's hyperbolic claims about impending measles pandemics. As they have stated previously, over 80% of Americans are already vaccinated. Instead of adopting an aggressive, combative stance towards those who refuse vaccinations, we should focus on education and dispelling the misinformation about vaccines that exists, while still respecting personal and religious rights. And as Offit, an author both the affirmative and negative have cited, has said, most people would get vaccinations if they simply had better information. What is the enforcement mechanism to ensure that people receive their mandatory vaccinations? Many county school systems already have require mandatory vaccinations for students, only allowing exemptions for religious reasons. If they remove religious exemptions, parents will simply remove their children from the school systems, further insulating their kids and making it harder to reach them in order to educate them as to vaccines' positive effects. We have never once argued against the efficacy of vaccinations. We too acknowledge that vaccines have eliminated many horrible diseases. But as Julie D. Cantor mentioned, mandatory vaccinations will simply drive people away. It brings to mind police state tactics, even if the affirmative is not calling for such tactics. People who distrust the government already will distrust the forms the affirmative calls for if the government mandates you attend those forms. People who distrust the state won't trust any forms that come from the state they distrust. Mandating vaccination is not creating a forum for discussion. Any form that is imposed on the public by the establishment with the goal to increase trust in the establishment will fail. You simply can't mandate trust. The affirmative has claimed that they provide the most freedom by freeing you from death. This is a gross overstatement. My partner and I aren't advocating for the banning of vaccines or attempting to make vaccination more difficult to access. Quite the opposite, in fact. Given that vaccinations have been proven to be perfectly safe time and time again, we believe that most people who distrust vaccinations now would readily adopt them should the government simply attempt to dispel the misinformation surrounding them. We should be leading with the carrot rather than the stick. If we try to force the few people now who don't vaccinate their kids to, all we will create is more mistrust, more conspiracy theories as people pull themselves and their children further away. And on to crisis preparedness. The affirmative's plan is actively hurting our crisis readiness by placing new administrative burdens on the pharmaceutical industry. Their plan hurts research and development. The manufacturing sector is not ready to handle producing a significant amount of vaccines. Because vaccinations are only administered once, supply chains are not set up for mass production. As our author, a UPenn pediatrics professor, points out of the only 4 major vaccine producing companies, none has revenue that exceeds 10% of total revenue. Regardless of who pays, they would significantly alter the pharmaceutical industry and create research trade-offs where research and development for emerging diseases falters. And vaccines are expensive. Drugs for people who are healthy are held to a higher standard than the are held to a higher standard. The affirmative would implement mandatory vaccines in a framework where companies have to deal with high legal costs for mistakes and burdensome red tape that is difficult to get through. And finally, there are the administrative costs. Regardless of who pays, as we pointed out, when the CDC simply changed its recommendation for the flu vaccine, doctors had to charge 5 to 10% above the vaccine's price to adopt to such a dramatic change in a short period of time. This covered the cost of enormous infrastructure required to purchase, store, administer, and record vaccines. We all agree that vaccinations are an incredibly important part of preventative medicine. and that more people who are vaccinated, the better. We only disagree with their methods, as long as less restrictive measures that designed to inform the public, to give them the perfect information required to realize the efficacy of vaccines themselves, and as measures such as quarantines, which can prevent pandemics that arise exist, then the affirmative must justify why we must rely on such extreme measures that trample on basic civil, religious, and bodily freedoms. Thank you, and I am now open for cross-examination.
Okay, so my first question is, you talked about how 80% of the population is already vaccinated. Do you know what the rate of the population that needs to be vaccinated has to be in order to get hereditary immunity and prevent the spread of deadly diseases?
I do not know.
Okay, it's over 80%. It's closer to 90%. So, how are you going to achieve hereditary immunity and maintain hereditary immunity just by offering a carrot, which we don't even know what it is?
Well, as I've pointed out, we should be dispelling the misinformation, which, as we've all acknowledged, is the primary cause of most people refusing to vaccinate their children. Most people aren't radical conspiracy theorists who, with these vicious anti-government positions, they could be led to believe these things if we just made, gentle attempts to persuade them instead of trying to force them to come to terms with something they disagree with.
Okay, what do those gentle attempts look like?
Well, all sorts of things. It could be anything from incentives to PSAs and announcements to try to help persuade people, information campaigns. I'm not saying I personally have all the answers to what we could do. I just know that there are better alternatives that exist that do not trample upon people's basic civic freedom.
But don't a lot of hospitals and healthcare organizations already engage in public service announcement campaigns and things like that to try to educate people?
So then we should increase them. We should provide more funding for these campaigns. We should try alternative avenues to bring people. We shouldn't just give up and resort to the most extreme measure possible because we're not seeing the greatest returns now. We should try every possible measure to improve vaccinations voluntarily before we make these attempts to mandate them.
Okay. Okay, you keep saying that these tactics are extreme, but in your first cross-sex, your partner said that states like California and stuff like that aren't police states or doing extreme stuff. So do you agree or disagree with your partner?
I would agree that California is not a police state. However, I think it should be pointed out that the road to these authoritarian states is a long one and a winding one. So such policies being implemented now sets a bad precedent for the future. And further, I would like to
Andrew, we can't hear you. Anyways, that's time, I think.
All right, we're going to give Andrew a few moments to see if he can recover his technology, but this is the point that we were going to stop and take questions from the audience. So this is your opportunity to ask questions. The Q&A box, which hopefully is working for you, is your opportunity to submit questions for us to ask. Much like the poll, it is not working for me. So I have some folks relaying me the questions. So bear with me if it takes a couple of moments. And hopefully we'll also get audio back from the debaters as well. But we do already have a couple of questions that have been submitted. And this first question is for the affirmative, who hopefully can both be heard. How would the affirmative determine which vaccines would be required? Would it be every vaccine ever made?
No, we're going to go with the recommendations by the CDC, which already people who are fully up to date on their vaccines have all of those. So that's going to be like decreasing numbers. You get older, so it's not going to be like you have to go in to get like 80 vaccines at your yearly checkup every year. It's for people who are fully up to date. You are fully up to date with the affirmatives requirements.
Okay, the next question is for the negative. Less than 50% of Americans get the flu shot every year. How do we know that they will get a coronavirus vaccine if one becomes available? Are we really willing to risk public health on the goodwill of some of our citizens?
So we would say that most definitely, as of now, those numbers are certainly not great. We believe that through better public engagement, we would be able to rectify those sort of numbers. Vaccines are great, and both sides are agreeing on that. And if being able to convince someone that they are good for creating immunity against diseases, then which is what the affirmative does, then certainly the same explanation can be given to people who are not getting those vaccines currently. We think that there's definitely room for improvement for how we package such information.
Okay, the next question is for the affirmative. Who is mandating vaccines? Would it be companies or governments?
It would be governments, and then your employer, or like for children, their school district would make sure that it is enforced. So the picture they paint of children being ripped from their parents' arms to be vaccinated is not at all what is going to be happening.
All right, the next question is from one of our distinguished alumni, Tom. What are the risks to the general population if some groups choose not to receive vaccines?
Can you hear me? Sweet. Well, there are definitely some risks that can emerge, such as the outbreaks that we've referred to. However, I would argue that these risks are relatively small so long as a majority of the population receives these vaccinations, which they currently are. And again, we should be engaging in other less, mandatory measures to try to persuade those people to receive these vaccinations, because if we mandate them, it will just result in people withdrawing from the system and avoiding it, which wouldn't increase it as much as the affirmative would like you to believe.
I'd like to add on to that, as well as make a distinction. Even though the majority of the population is getting their vaccinations, like one of the question askers pointed out, 50% of people, while it is the majority, isn't what we need to have herd immunity. So when you're looking at vaccinations, roughly that 80 to 90% where you need to be at for herd immunity would be considered like the proper majority. So it is that level that we need to get at for all vaccinations. And again, 100% would be preferable.
All right, the next question is for the affirmative. What percentage of those who aren't getting vaccinated do so for religious reasons?
Since that it's mainly like the only exemption that exists in some places, it's probably a significant majority, if not all of them. In some places, it depends on the state, so a large number probably contribute to that, but it's
a lot of these people in states without philosophical exemptions might be, or without medical exemptions, but still with religious exemptions, might be applying for religious exemptions, even though it's just like a, oh, I'm scared of needles sort of thing. So it's hard to get an exact percentage of what group of people who isn't getting vaccinated is because of their religious beliefs.
Our next question is, what are other countries doing in regards to mandatory vaccination, and which countries have achieved the near 90% vaccination rate?
So a few years ago, Europe had a resurgence.
I think Patrick might have frozen. Italy is the best example here. They have a huge percentage of their population is vaccinated. They are one of the EU nations that mandates vaccination. Also, Australia and I believe France are three of the big ones that mandate vaccination. And these, you see a huge, the huge percentage of the population is getting vaccinated, and they don't have the same measles outbreaks that we've been having in the United States, where the amount of people getting the measles their MMR vaccinations is lagging.
Do you have something to add, Patrick?
Yeah, I'll add something, because there was a resurgence in measles in a few European countries, most notably the UK, which was the closest any country in the Western world got to losing its measles-free status. And then the UK government introduced mandatory vaccination, and they got up to near 90% in just 2 years, and got back to hereditary immunity. So a lot of countries have done it, and it's pretty easy to do it.
Okay, I think the next question is directed toward the negative. How long before the negatives approach becomes effective, reaching a 95 to 97% threshold for impending disease prevention?
Sure. So we would say that definitely this would not happen overnight. However, we think that in the long term, when we are trying to, I guess, bring people into the fold who have been misled by misinformation, we definitely, I guess, like getting them that sort of information is definitely better when considering the cost of hurting people's freedom and also just like generally forcing them to do these sort of things. We think that this is a less restrictive way of like going about this problem.
Okay, the next question. Isn't it more indicative of a police state that only immigrants, an already marginalized group, are forced to get vaccinations?
I would disagree on that front. We require individuals entering into the United States to receive certain vaccinations, but that isn't necessarily evocative of a police state in the same way as mandating them for all individuals in the country, regardless of their philosophical or personal reasons. And that is perhaps an interesting discussion in and of itself. Perhaps we shouldn't mandate these things for immigrants, but just because we're doing it for this group doesn't mean we should expand it and infringe upon the rights of all people throughout the country.
Okay, the next question, basically on the premise that there's an argument been made about the economy. How would mandating vaccines hurt the economics of pharmaceutical companies when they would be the ones benefiting from more vaccines, and with more people always being born, the demand would be continuous?
Sure. So we would first point out that the supply chain isn't exactly set up to handle vaccines, as admitted by our opponents. By mandating vaccines, we would probably have to produce substantially more, and as far as there will be new strains of diseases that we will need to make vaccines for, but also diseases we just haven't seen yet. So upon that happening, we only have 4 major companies that are still making vaccines. And as of now, their revenue from vaccines is less than 10%. This is because it's just not as profitable to them as compared to drugs. This is mainly due to the fact that vaccines have enormous legal hurdles to pass when getting approved. And as far as approving a drug for healthy people is way harder than one for sick people. So for that reason, like it's definitely going to hurt the economy, or not just the economy, but also our ability for these companies to prepare for these future diseases and sort of invest dollars in R&D, like for these future problems.
I have to just jump in as an economics major and say that that this overstates the size of the pharmaceutical industry, and also this is one where if it can save people's lives and prevent diseases, who cares about the profits? So I think that what really matters is how are we preventing diseases and preventing the outbreaks of deadly diseases when we have the means to do it, not the amount of money that's being lost or made in the process of doing so.
Okay, the next question is for the affirmative. Is the plan that the affirmative is advocating and providing information like the negative is advocating, are those really mutually exclusive?
Yeah, we are both advocating on the same side for that we want an increase of information. However, we have 2 different ways that we want to get across to that. The affirmative side, we're looking at having the mandatory vaccination, so people are required to go to their doctor or a nurse to have that form of communication open up along with getting their vaccinations. And on the negative side, they just want to have information campaigns, which we have already proven in the current crisis to not be fully effective in working to get people to stay at home or stay away from large groups, and in the past haven't led people to getting their flu shot or MMR vaccinations.
Okay, the next question is for the negative. How will the negative get those who don't trust the government to listen to the government with more information rather than mandatory action?
That is an interesting question. And again, I don't claim, or the negative doesn't claim rather, that we would be able to reach every person through our methods. However, I believe that there is still a large amount of people who don't trust the government, who aren't rabidly anti-government, who aren't as rabidly conspiratorial as many people might believe. And over time, perhaps it might take years, but over time we could, I believe, reach these individuals slowly and gradually. And if not them, we can reach their children and eventually help disperse these myths. But if we mandate vaccination, you're playing right into their mistrust, right into their fears. And that's just going to lead to more conspiracy theories and more opposition than you would get if you used less restrictive measures.
Okay, the next question is for the affirmative. The questioner writes, both sides have repeatedly said that vaccines are safe and effective, but the reality is that they are not. I have had a serious vaccine injury, temporary paralysis. The reality is that pharma companies paid out billions in damages for vaccine injuries. Currently, there's been a push to remove liability for vaccine injury. Do you agree any mandatory vaccines would have to pay out for injuries?
Well, there's also ways to now to check to make sure that that doesn't happen. There's ways to do testing to prevent giving vaccines to people that may have an allergic reaction if we just did the proper testing. But that's also a very different discussion. But yes, in the meantime, of course, we need to give out payouts for any injuries and the damages and liabilities those create, and any move to deregulate pharmaceutical companies is a bad idea, because it's something that we should want, especially if we're going to implement it on a widespread scale, to be something that's effective and not something that burdens people or hurts them.
And yeah, I have to agree with my partner here. We, as well as advocating for these things, think that we should keep full, strict liability on companies, preventing them from cutting corners so that they're able to maintain a profit. Because the reality is, some people do have medical conditions or allergies that they aren't aware of, that they don't become aware of until they get a vaccination. So it's really important that we're able to protect this group of people, and at the same time, do as much research as possible to make sure that people don't have a similar experience, and that we are able to keep the entire population safe.
Okay, the next question is for the negative. What is an example of a public health information campaign that succeeded, and what was the percentage result of that campaign? How many people changed their behavior, for example?
Well, I don't have a specific number on it. I think a lot of get out the vote campaigns in recent years have been extremely beneficial, especially in that they have taken advantage of newly emerging technologies such as social media. So I think that there's definitely a lot of room to grow, especially as a lot of people are transferring onto more digital platforms. I think people are generally more easy to reach than they have in the past, which is definitely helping our case.
Next question is for the affirmative. Doesn't herd immunity work if enough people are vaccinated?
Yeah, herd immunity works if enough people are vaccinated, but we are not at that threshold yet. Like someone pointed out earlier, it is roughly 90% or thereabouts, where we are only at about 80% for some vaccines, as low as 40 or 50 for others. So while the average looks promising, when you break it down to specific vaccinations, we do have the possibility for resurgence of very dangerous things, like H1N1, avian flu, all these different things, that it's really important that we have that 80 to 90% for all vaccinations, not just an average.
Okay, next question. Aren't governments motivated by campaign dollars, which could mean that drug companies who contribute so much money would dictate the vaccines required? This is probably aimed at the affirmative.
Patrick, do you want to take this one?
Yeah. Well, that's a question that doesn't have to do with that. I don't think addresses the question of are vaccines effective? I think that it's a question about the campaign finance system and the American system of government, more than it says anything about the medical community, and the doctors and the people that administer the vaccines and the people who are developing them for noble reasons. Once you get the economics, the money, and all of that involved into it, yeah, there is some corruption that can happen there. But that's also a matter of also making sure that we have a strong and well-funded NIH and CDC, independent entities that can look at that and give strong recommendations, and also have the money themselves to get out there and tell people what they do and do not need, to make sure the government is held accountable on that stuff. But also, it's something about making sure that we have a system that really does promote that promotes doing what's in the best interest of people. And that's when you need to look at the issue of medical patents and how long and how tight patents can be for individual companies, so then that the profits are spread out and that one vaccine doesn't make the day for just one company.
Okay, we're going to ask a few more questions here and then we're going to wrap up. If some people do not want to get vaccines, what could the nation or state do to enforce them?
Yeah, so that's, I laid out a few different examples of enforcement mechanisms in my first speech, with making sure that they're provided in schools or workplaces and require them. At the end of the day, we're not going to be able to reach 100% of the American population, because there are some people who do live off the grid, but it is important that we get that percentage of the population that we are able to get in contact with, because that is greater than 80% that we have now. So we need to get in touch with these people and ensure that they do get their vaccinations, and that we are able to protect the population as a whole.
Okay, next question. Vaccines aren't just for young students entering school. How would you handle elderly people who also need vaccinations for shingles? Would you mandate elderly people in good health be vaccinated at age 50?
I would say yes. If it is safe for them, then they should get them. Yes, we would mandate the vaccination. But again, we are not getting rid of medical exemptions. So if the person isn't healthy, has any allergies, or has any risk factors, we would not put them at risk. That's why it's important for the majority, or for the healthy population, to get vaccines, so that we can protect people who aren't able to.
Right. For the affirmative, assuming the federal government would be paying for the vaccination, what part of the federal budget would be allocated for vaccination, and how much do you estimate it would cost over the next few years?
Money's your expertise, Patrick.
Okay, well, actually, the federal government wouldn't be paying for all of these vaccinations, because, as the negative has even conceded, so some of it comes to insurance companies, and therefore people pay for them themselves through the insurance system, because they're covered. Yeah, there are a few cases of people with their children who don't have it get it through schools and stuff like that, as has also been acknowledged there. But the vast majority of the vaccinations, unless we switch to a single-payer healthcare system, would not be paid for by the government itself. Research and development of some of these, for things like the coronavirus vaccine, which has a trial going on right now, yeah, those are run, administered, and in some cases funded by the government, who's trying to help the pharmaceuticals develop these vaccines to get them out quickly. But it's not the government paying to vaccinate everyone. That's not what we're advocating for. What we're advocating is a system that mandates that people, in order to go to work, in order for their kids to go to school, they need to be vaccinated in order for them to be out in the public and to keep the public safe.
Okay, the next question, I think this one is a little bit geared toward the neg. With all the literature that's given to families at baby appointments, at schools, doctor's offices, where else can you educate the kids? And what about adults?
Well, one fantastic measure to educate children is through the school system, which is part of the fear. If we mandate it, parents can remove their children from the school systems, which would sort of prevent one of our major methods for reaching these young kids. As for adults, that is a bit more tricky. However, I would say, given the rise of the internet, there are all sorts of exciting new opportunities to reach people who possess even a basic Wi-Fi access, as well as things such as public speeches and forums such as that. Governors can do public awareness campaigns in their own cities and provide sort of individualized context within certain communities. But I think those are two major ways you can reach people currently.
Okay, along those lines, regarding that question for the affirmative, how do you respond to the negative's argument that compulsory enforcement leads to increased isolation or ostracizing of children, which would increase the risk of diseases spreading?
So already in schools, students are able to opt out of certain curriculums if their parents don't believe in it. So you do have the ability for students who are even remain in the school system to become ostracized, which isn't something that the negative team addresses at all. However, people, if they don't want their children to learn what's being taught in schools, they're going to pull them out, which is an example from the book Educated that I referenced. That was the common read this year at Mary Washington. If people don't want their kids to get vaccinated or learn about vaccinations, that is a whole other situation that we need to tackle. However, there are going to be kids that just because their parents are afraid of needles or don't want them to get vaccinated for any number of reasons that aren't conspiracies, doesn't mean they're going to pull their child out of school and switch to homeschooling because their teacher said, hey, maybe you guys should get vaccinated. Or, hey, let's all go to the gym and we'll just get a quick shot. It doesn't hurt at all. Like, the majority of the population, like the negative pointed out, isn't these people like with tinfoil hats in their basement that thinks the government's trying to control their mind.
All right, on that note, we're going to wrap up the question period. And those were some great questions, folks. Thank you very much for your participation and your engagement on that. We'll now conclude our debate with a final speech from each side.
So first, we aren't calling them conspiracy theorists or discrediting their arguments in any way. We are saying that in the current climate, it is more important than ever that we work together to ensure safety of all groups by removing personal exemptions from vaccination requirements. Any exemption is denialism, and people's lives should come before personal or religious preferences. We aren't getting rid of religious freedoms, and this has been proven by constitutional in states and countries that mandate vaccination that still have the same religious freedoms as those that don't. Upwards 80% of people get their vaccinations, so the system isn't going to be overloaded in a way that is detrimental to public health, the economy, or research and development. Because our plan doesn't require new types of vaccinations to be made, infrastructure isn't going to be overrun, and it won't need to evolve in a significant way. Since new vaccines are being developed under our plan, we don't need to worry about the red tape or administrative issues that they reference. We open up discussions between doctors and previously untreated patients, which is important and to public education. Their method of just putting doctors on the front line will not work. Trump has already silenced medical professionals, and their belief in basic human decency has been proved to be wrong time and time again. They couldn't even answer how they would prevent politicians from silencing experts. The COVID-19 outbreak proves that even with widely available information, people will not listen or prefer misinformation. People have died because of misinformation that is spread by President Trump about cures for the coronavirus. The police state picture my opponents paint is ridiculous. We need a method to prevent death from preventable diseases. We aren't taking children away from their parents. We are providing vaccination in schools. People won't get arrested for not getting their vaccinations. This is a huge threat to global health. Many EU nations mandate vaccination, and 5 US states already do. We as a nation need to do more to prevent the spread of diseases. They suggest California is on the winding road to authoritarianism. That shows how obscene their argument is. Next, our opponents have, so many lives are saved each year because of vaccination. We need to incentivize people to get vaccinated further than just information campaigns that can easily be ignored. It is the responsibility of those who can get vaccinated to protect those who can't. The cost of prevention is much smaller than that of cleanup. We need to work with public health to ensure that everyone has the greatest freedom of all, that of public health. The negative even agrees we should mandate vaccination in some cases. And I urge you to vote for mandatory vaccination so everyone has the access to that freedom. Thank you.
We are not saying not to get vaccines, and we're not denying the public health benefit of vaccines. While our opponents want to write us off as anti-science conspiracy theorists, our main qualm is with the government telling us what we can and can't do. If there is another, less restrictive means, then we should pursue it. We all have reasonable right to privacy and choice, especially when it comes to one's body and allowing religious exemptions. We believe that mandatory vaccination would lead to a slippery slope. If governments can regulate us and punish us for choices concerning our bodies, then they can begin to legislate on incredibly sensitive and private matters. Further, the regulation of the choice itself is problematic, as when people are forced by the government to take particular actions, they become fearful and distant. Now, our opponents tried to paint their position as people would go to their doctor's office to have some sort of discussion. Keep in mind, the affirmative is an absolute. There is no discussion about vaccinations. You have to get them, or your child is taken out of school and you are fired from your job. Now, our opponents have also said that we don't answer our opponents also said that the slippery slope just is not true, in as far as their example of California. However, we would argue that if it was a national mandatory vaccination, this would be an incredibly harsh stance against religious freedoms and also freedoms of choice with medical choices. Now, our opponents have also said that we do not answer how people are going to react to public information. Their argument here is that leaving it up to the people does not work. They pointed to the example of how like the Trump administration has been overshadowing many public health officials. We do not think that this is right, and we are not advocating for the status quo where these sort of things can happen. We believe that we can much differently package how we present information. If we are talking about who is bringing people into the medical medical fields and doctors' offices, it is definitely going to be not the side that is going to be forcing people to come in and get vaccines that are very harmful to their religious freedom, choice, and livelihood. Now, I would also like to move on to our second point, which is that vaccines hurt our ability to prepare for future crises. My partner pointed out well in his speech that vaccines hurt current research and development as companies are not able to set up responses to diseases. Vaccines are expensive to produce. A mandatory system would incur a large administrative cost passed down to consumers, and mandatory vaccines breed resistant diseases, which will have more problems in dealing with in the future. Now, our opponents say that people are getting vaccines now so the system won't be overburdened. However, we would point to their concession and cross-sex on how every single new disease or new strain is going to need a vaccine that is going to be mandated by the affirmative. So they are most definitely going to be overrunning the economy. Further, they have no answer to our question of whether or not these costs are going to be passed to the consumer. They say it's a question of insurance. But this doesn't matter if a significant portion of our young people are not insured because the costs are prohibitively high. They have to deal with this, and also for the ability for insurance companies to pay for increased prices, and whether or not they are even going to cover these in future plans. So this is definitely a problem they haven't grappled with. So in sum, public health is important, but it should not come at the cost of freedom of choice. The affirmative only has a chance of driving people away and making our ability to respond to diseases harder. We believe that educating the public so that they can make better decisions is a transparent way to build trust in the medical system while helping people to choose to live healthier. Thank you.
All right, folks, how about a virtual round of applause for our debaters this evening? And I would like to especially congratulate John, who was our final speaker there on what was his last speech on behalf of UMW Debate. Thank you for your wonderful time on the team. We're going to miss you. I also want to take a moment to thank our alumni coaches who were helping out with the tech issues on the back end that were failing for me. Gabe Lewis and Terrell Taylor were feeding me the questions that I could no longer see since that part of my Zoom app is not working. And I also would like to thank you, our audience, for engaging and thoughtful commentary and questions tonight, and for your patience with our technological difficulties. We're gonna spin the wheel one more time on the technology thing here. I do have some poll questions. It's my understanding that you folks could see them. Whether or not they actually are getting recorded is a whole nother question. But I am going to try to launch the post-debate polling questions again. And if that fails, we will figure out a moment for you to answer them in the question and answer section. So I have launched the poll, and it says attendees are now viewing the questions. But it also said that last time. And nobody's voting. So my guess is that maybe even if you can see them, you can't answer them. So I'm going to tell you what the questions were. and you're going to think about a couple of them. Remember at the beginning, I had asked you folks to think about what your opinion was of mandatory vaccination. I would like you to consider your opinion again and ask yourself whether or not it has changed, basically. The options, again, were strongly in opposition, moderately in opposition, undecided, moderately in favor of mandatory vaccination, or strongly in favor of mandatory vaccination. And basically, the real question, though, is did your opinion change at all based on this debate? So if you take a moment to think about that, you don't need to report that one in the questions and answers. You can if you'd like to. We certainly are interested in whether or not we changed your opinion or altered your opinion in any way. But the main thing that most people usually like at the end of these debates is a vote on who won the debate. So that is the final question that was asked in the poll. And this one I would like if you could answer in the questions and answers section. So which team do you think won this debate? The affirmative team, supporting mandatory vaccination, or the negative team opposing mandatory vaccination? So the affirmative team supported it, the negative team opposed it. So if you could report your answer in the Q&A section, and we're going to give my esteemed colleagues a few moments to check your answers so that we can figure out who you folks thought won. It's really unfortunate that there's this awesome polling feature that just isn't working for us tonight. Meanwhile, I do want to say, if you enjoyed this or if you're interested in the debate team, please consider following UMW Debate. We're all over social media, which is possibly how you got here in the first place. We will offer additional opportunities in the future to consider to have other civic discussions and debate questions in the future. This is part of a class, so we do this on a regular basis, and we also have a team that competes on a regular basis, and so we're ready to do pop-up debates at almost any time. So I'm going to put up our social media information while I wait for another moment or so to see if we get some reports on what the voting looks like. The votes are coming in slow. I appreciate your patience, and I appreciate that you're voting this way as opposed to through the poll, which was, I promise you, we did practice this, and these things all worked during practice. But you always got to have a backup plan, and that's why I had other people standing by in case something like this happened. So hopefully we'll have the tally in a few moments. You should hum the Jeopardy music while we wait. All right, and my sources are reporting that a majority of the ballots were cast for the affirmative team. So congratulations to the affirmative team on this evening's debate. We'll set up a rematch for at some point later in the season. Thank you very much, and again, thank all of you for participating and watching our debate tonight. Everybody, thank you for joining us. Stay safe and have a good night.